Hey everyone, and welcome to the PTCB Prep Guide. This is where we break down tricky pharmacy concepts to make them super easy to understand and remember. Today, we are diving deep into gastrointestinal disorders, or GI disorders. We're going to cover all the key definitions, the must-know medications, some real-world pharmacy examples, and of course, a few memory tricks to help you absolutely crush your PTCB exam. Okay, so I want you to picture this. Your whole GI tract is like a busy food highway. Today, we're going to be the traffic reporters, checking out what happens when that highway hits traffic jams, gets some nasty potholes, and has unexpected detours. We'll look at the conditions, the high-yield drugs you got to know, and the critical counseling points that will for sure pop up on test day.
So here's our roadmap for the day. We'll start at the top of the highway with upper GI traffic jams, then we'll move down to the intestinal highway problems. After that, we'll check in on some accessory organ alarms, run through a super fast high-yield drug review, and then wrap it all up with a final exam checklist. Sound good? Let's get into it.
All right, our first stop is the upper GI tract. We're talking about the stomach and the esophagus. This is where some of the most common bottlenecks happen, things like acid reflux and ulcers.
First up is GERD. You'll hear it called gastroesophageal reflux disease. Basically, what's happening is the little valve at the bottom of the esophagus gets a bit weak, or kind of lazy, and it lets stomach acid splash back up where it really doesn't belong. And that causes that classic, awful burning feeling we all know as heartburn. Now, a key counseling point for your exam is knowing the triggers. You'll want to be able to tell patients to steer clear of things like chocolate, caffeine, and alcohol to help keep those symptoms under control.
So this slide is awesome because it breaks down the three main ways we fight back against acid. You've got antacids, like Tums. Think of them as the firefighters. They rush in, they work super fast, but they don't stick around for long. Then you have the H2 blockers, like Pepcid. They're a bit slower to get going, but the relief lasts longer. And finally, you have the heavy hitters, the PPIs, or proton pump inhibitors, like Prilosec. These are the most powerful, and here's the exam pearl. They work best when taken before a meal. Why? Because they shut down the little pumps that make acid, and those pumps are revving up right when you're about to eat. Knowing these differences is a total classic exam question.
Next on our tour, we've got peptic ulcer disease, or PUD. The easiest way to think about these are as painful potholes digging into the lining of the stomach. Now, for the PTCB exam, you have got to know the two main culprits that cause these potholes. First, there's a nasty little bacteria called H. pylori, and second is the long-term chronic use of NSAIDs, like aspirin or ibuprofen.
Okay, let's continue our journey down that food highway and head into the intestines. This is where we can run into a whole different set of problems, like serious inflammation and even blockages.
And this slide right here illustrates a super high-yield topic for your exam, the two main types of inflammatory bowel disease, or IBD. On one side, you have ulcerative colitis. Think of it as one long, continuous stretch of inflammation, but it's only in the colon and rectum. Crohn's disease, on the other hand, is different. It shows up in these patchy spots, and it can be anywhere in the GI tract, from top to bottom. Plus, it can go deeper, affecting all layers of the bowel wall. This comparison is a test day favorite, so make sure you've got it down. All right, let's put on our pharmacy tech hats for a second. A patient comes to the counter and they're describing symptoms of constipation. What's the logical order of treatment you'd expect the pharmacist to recommend? Just think about it for a moment before we jump to the next slide.
And here you go. The foundation, step one, is always lifestyle changes, drinking more water and getting more fiber. If that doesn't do the trick, the next step is usually a bulk former, like Metamucil. Still no luck? Then you might try a stool softener, like Colace. And finally, for those really stubborn cases, a stimulant laxative like Dulcolax can be used to really get things moving. This stepwise approach is a really important concept to grasp.
Now, on the complete flip side, you have diarrhea. And listen up, because here is a crucial safety alert for your exam. While staying hydrated is absolutely priority number one, you need to know that antidiarrheals like Imodium aren't always the right move. If there's any chance it's food poisoning, the body actually needs to flush out those toxins. Stopping that process can trap the bad stuff inside and actually make the person sicker.
The GI tract doesn't work in a vacuum. It gets a ton of help from what we call accessory organs, like the liver and the pancreas. So when these connected systems start having problems, it sounds alarm bells for the whole digestive process.
Take pancreatitis, for example.
That's just inflammation of the pancreas. It's often kicked off by things like alcohol abuse or gallstones, and it causes this severe, intense pain in the upper abdomen. This is not something you treat with over-the-counter meds, okay? This is a serious condition that requires a trip to the hospital.
And then you've got cirrhosis, which is basically late-stage scarring of the liver. Now, while it's often caused by long-term damage, here is a critical counseling point for you to lock in. An overdose of acetaminophen, that's Tylenol, can cause severe and very rapid liver damage. This is a huge safety warning you have to know. All right, we've covered the major GI conditions. So now, let's buckle up and dive into a rapid-fire review of the must-know drugs. Think of this as your PTCB exam cheat sheet. So let's get ready to match those generic and brand names. For constipation, first up we've got Psyllium, brand name Metamucil. This is a bulk former, so the single most important counseling point is to tell the patient to drink it with a full glass of water. Next, Docusate, or Colace. That's a stool softener that just makes things a bit easier to pass and helps prevent straining. And finally, Bisacodil, brand name Dulcolax, which is a stimulant. It gives the intestines a little kickstart to get things moving.
Now for diarrhea and nausea, you've got Loperamide, which is Imodium. It works pretty simply by just slowing down the gut. Then there's Ondansetron, brand name Zofran. This is a prescription drug, and it's absolutely vital for preventing the really intense nausea and vomiting that can be caused by chemotherapy. And for motion sickness, a common one is scopolamine, the Transderm Scott patch, which, you guessed it, is a little patch that goes right behind the ear.
And to round it out, let's hit acid, gas, and inflammation. First is omeprazole or Prilosec, our powerful PPI. For gas relief, there's simethicone, which you'll find in Gas X or Milacon. Here's a key fact. It only breaks up the gas bubbles that are already there. It doesn't stop your body from making more gas. And for the inflammation we see in IBD, a key drug to know is sulfasalazine, brand name Azolfidine. So with all these different classes, how are you supposed to keep them straight? Well, I've got a little memory trick for you. For PPIs, like Prilosec, just remember this. They permanently pump the brakes on acid. That little phrase with the 2 Ps will help you separate them from the other acid reducers on your exam and really lock it into your brain.
Whew, we have covered a ton of ground on our trip through the GI tract. So let's wrap this all up with a really clear, simple checklist to make sure you are feeling confident and ready for test day.
First things first, take a few minutes to just review the notes you took today. If anything felt a little fuzzy, don't be afraid to just rewatch this explainer. And, most importantly, make practicing those brand and generic drug names a daily habit. Seriously, repetition is going to be your best friend for the PTCB exam.
You did an awesome job reviewing GI disorders with me today. I know it can be a tricky topic, but you are absolutely on the right track to passing your PTCB exam. Hey, if this explainer helped you out, please take a second to hit that like, subscribe, and share button. We post a brand new simplified pharmacy topic every single day to make your studying easier and your exam prep that much more effective.
Keep up the great work, stay focused on your goal, and always remember, you've got this.